I want to ask you a little bit too, and for those not in the acute hospital industry, this may be unfamiliar to you, but I've written a lot about it in my books. I've been highly critical of the meaningful use requirements that came about in 2008, forcing hospitals to implement electronic health records within about 10 years. And my criticism has been a tremendous amount of waste, financial waste, a tremendous amount of power is now in the hands of 2 or 3 electronic medical record companies that really wag the dog, for lack of a better term, in some hospitals because they're so influential, and really focusing on the requirements written by legislators that really didn't understand acute care as well as they needed to write them. The point I want to make and ask you about is we spent 10 years implementing requirements so that we were better connected. The good news is once we were done with that, we could actually start doing the right thing for patients and for health systems to deliver better care. And so that's been about 3 years since about the time you came on board. So what in the post meaningful use is just the term, folks, if you're not familiar. It basically required health systems to implement meaningful electronic medical records within 10 years and phased it in. By about 2018, that was done. But since then, it's been a lot more fun and enjoyable to say, now let's do something worthwhile with those implementations. Can you give an example of what's really changed since meaningful use was kind of like, okay, we got that done, now we can move forward?
Yeah, luckily I missed that phase. You mentioned I joined 2 years ago, so I'm in the honeymoon phase where we can benefit from it. So I can't really contrast how painful it was before, because thank goodness I missed it.
Yeah.
But the benefit coming in, all of our data is an electronic health record system. Is you now have the foundation to do these more innovative things, right? Because as important as the electronic health record is, maybe that gives you 20% of the insight. But it's kind of creates that core, that single, identifier of a patient to do these additional things. And so, adding on the image data, adding on DNA data, starting to add on the Internet of Things, the wearable data, it gives us a framework to start hanging information off of that. Yeah. The 80% that's frankly missing from the medical record that can give us insight. And so, I came on board, and thank goodness, we've got this patient master and an electronic health record, and the core data is there and taxonomized and relatively clean. So then it allows us to do these other things. And when I talk about big data, it's really that evolution, right? Because electronic health record is not big data. It's actually a pretty small data set about a patient. But now that we have it, we can hang with patient, consent, all of this other data off of it. And then that's where, these future technologies like artificial intelligence can gain the insight, based upon your activity, based upon, heart rate monitor data that is being uploaded real time, based on the information we have on your electronic health record, based on image data that, images that you may have taken, we could have insights that we never would have had before meaningful use without the electronic health record. So
it's really personalized medicine is what you're talking about. And really just focusing on, I'm a Gen Xer. I'm a proud Gen Xer. We were raised that healthcare is reactive, right? In the 80s, it was if you're hurt, you go to the doctor. Now, though, it's all changed to it's healthy living and healthcare morphing into one, because you have this personalized roadmap, whether it's a DNA test or the microbiome, finding out how your gut metabolizes food or your body metabolizes medication. So all those things are really exciting